Alright, so welcome to another segment where we'll be looking at the pathology of the respiratory system. Okay, so to start with, we'll start by looking at the organ, the organ of the respiratory system. So it usually starts with the nasal cavities. So on the nasal cavities there we have the nose nares and the paranasal sinuses, as well as the nostril, the oral cavity, as well as the pharynx. That is just the throat. And then we have the larynx, which is the voice box. Then we have the trachea. Then the trachea bifurcates, forming the primary bronchus as well as the secondary bronchus, and then it gives off to the tertiary bronchus, where we get to see the alveoli and other parts of the air sac. And then in there, this is where we tend to have cells such as the pneumocyte type 1 cell. Remember, we have pneumocyte type 1 cell, which are these cells that are just important for they usually carry 95% is just for gaseous exchange, and 5% it is for type 2 pneumocyte cells, which just helps the lungs from collapsing. Okay, then when you look at these two lungs here, you need to notice that the right lung, anatomically, it has three lobes. So the upper lobe is what we call the superior lobe, and then the second lobe is the middle lobe, and then the last one, it is the inferior lobe. Okay, then on the right one we only have on the left one, sorry, we only have just two lobes. We have the superior lobe as well as the inferior lobe. Then that it is separated by that line, which is just an oblique line that separates these lines. Again, in between we have what we call the intercostal muscles as well as the diaphragm, the one that helps out. Okay, so now let's look at the content. The upper respiratory tract consists of the nose, the pharynx, that is the throat, the larynx, that is just the voice box, the trachea. These are the parts that makes up the upper respiratory tract. Now, on the lower respiratory tract, we have the lungs, the bronchi, the bronchioles, as well as the alveoli. Okay, so these are also parts that makes up the lower respiratory tract. You need to know this and just take them, like that. So these are the organs like I've shown you. Okay, so now let's look at the contents. So under the content, our content here, we'll look at the upper respiratory tract. We'll start with the sinuses, the sinusites, as well as the larynx, the vocal nodules, and the laryngeal malignans, and the laryngeal carcinomas. So carcinomas, remember, we're looking at pathology of the respiratory tract. So pathology of the respiratory tract, we're trying to compare now the abnormalities that usually happen in the respiratory system, the respiratory tract. Yes, so you need to understand the normalities, the anatomy, and the physiology that usually occur in a normal respiratory tract. So now our focus here is on the abnormalities. So the lower respiratory tract, it receives these infections. So infections that are very common in the lower respiratory tract. We have pulmonary infection. The pulmonary infection, these are common, as well as atelectasis, it's also common, and pulmonary edema is also common. So pulmonary edema, so these are the conditions that are just common in the respiratory tract. So edema is just the swelling, all these infection, whatnot. Then also acute respiratory distress syndrome. So this one, acute respiratory distress syndrome, it is also another common condition that is common. So look at them one by one in depth. Then we also have obstructive pulmonary disease, where there is an obstruction within the pulmonary. Then diseases of vascular origin, such as pulmonary embolism or tumor. So pulmonary embolism, this is when there is something that is just breaking the that is just blocking the blood vessels from supplying inadequate blood to the lungs so that gaseous exchange can take place. Okay, so let's start with the sinuses. So on the sinus, the sinuses. So on the sinus, we have what we call sinus. On the sinus, we have what we call an infection that is just the one that infects the sinuses. This one is associated with acute chronic, that is, acute chronic rhinitis. So these are just bacterial infection that usually affects the sinuses. Okay, then we have bacteria or the fungus. So the signs and symptoms for this one, usually we tend a patient to be experiencing pain in the sinus. That's just the opening part of the nostrils. Remember the paranasal sinuses, those sinuses that are found in the respiratory tract. Then we have areas of the nasal dropping, as well as chronic cough. So a person will be coughing, experiencing all these. Then the reaction, these infection reacts to like antibiotics. So you can only prescribe antibiotics to such kind of infection that is just affecting the respiratory tract. Then the vocal nodules of the pharynx, of the larynx. Okay, so the vocal node of the larynx. So the larynx, we're just referring the voice box. So how does these infection usually comes about the larynx? Number one, people that smoking, as well as what singers. So people that smoke and those people that sing, they usually tend to have these, like, something that irritates the voice, the larynx, which is just a voice box. And that's the reason why, if you've been singing or maybe shouting so much, people tend to have the voice is like as in disturbed or tempered sometimes, due to you've um, you've overexpressed yourself so much that, and then it has now made your vocal cords on the larynx, the throat, the voice box to become loosened. Okay, so now let's look at then the other part is just the small nodules that are found at the true vocal cords, as well as the hoarseness. No, hoarseness is when your voice is hoarse, like it becomes too depth, like as if it's a bass, a bass tone. Yeah, that's just the hoarseness. Then benign lesions. These are some of the conditions that are commonly found on the larynx. Okay, then let's look at the vocal cords. So that's how the vocal cords of the larynx looks like. Okay, so when they open up, that's how they appear. And if there is anything that will temper to these vocal cords, a person can even lose the ability to speak, as well as even how to articulate themselves in a proper manner, or uh, or the way they just want to uh, maybe express themselves and whatnot. So all those parts, they usually tend to be affected. Okay, so this one, it's called the polypo angiomatos or the pregas vocis. Yeah, so this one, it is just um the vocal nodes of the larynx. Okay, Now, let's look at the carcinomas that are common in the larynx. So, number one, we have the one that is these carcinomas. We're talking about conditions, this cancer cells, the abnormal growth of the cells that are found within the larynx. Like most of these abnormal growth causing what we call the cancer abnormality of these cells, it is mainly associated with smoking as well as drinking alcohol, and also squamous cell carcinoma. Remember, the squamous cell carcinoma, this is it's a metaplasia that usually occur within the respiratory tract when a person smokes, where you find to say that the columnar epithelial cells are replaced by the squamous epithelial cells, and that's just the carcinoma that occur within the larynx. The hoarseness on the neck, the or the neck mass, if if metastasis to the cervical lymph node. So when you every time you come across the word cervical, just think about the neck. So it simply means the neck of something. So just the neck of the lymph node, and yeah, then this kind of viscous condition here, it is treated by just a surgery or combination of it, or combined with what, radiation, where you use the x-rays and all these radiation to remove it up. So imagine this was just the normal larynx, and then this one is just the carcinoma, like it's abnormal, it has infection and whatnot. It becomes, the color starts will start changing, the cell will change in appearance, and then you start seeing all these forms. Then the lower respiratory tract, we have, okay, so the lower respiratory tract, let's look at infections that are common in the lower respiratory tract. Well, we have pneumonia. Pneumonia is one of the common condition. Community-acquired pneumonia as well as hospital-acquired pneumonia, which is known as nosocomial pneumonia. So nosocomial pneumonia, this is the pneumonia that's just acquired in at the hospital, maybe about 72 hours, that is 3 days after you've been admitted. Yeah. Then we have a typical pneumonia as well as aspiration pneumonia. So all these are just the components that we are going to discuss, which really which are infectious disease of the lungs, especially the lower respiratory tract. Also lung abscess as well as pulmonary tuberculosis. Okay, so now let's look at the first one, which is community acquired pneumonia, abbreviated as in CAP. The predisposing factor, number one, this one is more common in old age, and also especially in people that are having chronic disease relating to COPD, which is just chronic obstructive pulmonary disease, or it can either be CHF, that is congestive heart failure, or DM, that is just diabetes mellitus. So people that usually have these conditions, they are at a higher risk of having community acquired pneumonia. Also, those people that have immune deficiency, even them, they have a high risk of having this disease. Also, we get to see it in decreased or rather abscess splenic function, like in sickle cell disease, the one that is also present in the post phreniectomy. So post phreniectomy, like this one, it's when you are just from doing a surgical procedure of the spleen. Okay, it's called splenectomy. Okay, the removal of the incision that is done in the spleen is called splenectomy. So the post splenectomy, this one talks about people that are also at a high risk of having the disease that we are talking about, which is community acquired pneumonia. It's even those people that are just coming from an operation of an incision that was just done upon an operation that was done in the spine. Okay, then risk of infection can encapsulated by bacteria or pneumococcus. So pneumococcus, okay, so these are just part of the bacteria that usually affect these. Okay, what are some of the clinical causes? Number one, we have it abrupts the onset of high fever with chills. So someone will experience high fever as well as with chills, swelling, and then mucopluent, which is just productive cough, where a person is just coughing continuously. Then there is also dyspnea, which is just difficulties in breathing, where someone is just laboring as they are breathing. Also, it involves what we call the pleural as well as pleuritic pain, where you feel pain within the thorax. Then also other thing that we can expect, they are just repetition as well as decreased in the breath sounds. Okay, then the causes of these common acquired pneumonia, it is caused by, remember, streptococcus pneumoniae. This is just also, it's a bacteria. Yeah, remember we did look at the gram positive and gram negative bacteria and how they are, their morphology, the mode of the pathogenesis, and how they get transmitted and whatnot. Okay, then also it's also caused by Haemophilus influenza, which is also known as acute exacerbation of the chronic obstructive pulmonary disease. Then it is also caused by Staphylococcus aureus, as well as the Klebsiella pneumoniae, which is just pneumonia, which is just the chronic alcoholism. This one, yeah, it's one that also causes the common acquired pneumonia. Then also Pseudomonas aeruginosa. This one is also the major cause of common acquired pneumonia. So cross-examination that is done on a patient. Number one, you need to cross-examine. You need to do the gross pattern on the anatomical distribution, where you need to assess the bronchial pneumonia, that is just patch the consolidated along the bronchi and the bronchioles. So you need to understand your, like, as in the anatomical distribution of these the bronchi. Okay, then also the labral pneumonia, which is just a consolidation that involves the entire lobe of the lungs. Okay, so when you look at these entire lobes of the lungs, that's how they usually looks like. They appear like this. This one is the bronchopneumonia. Bronchopneumonia, it appears like that. Okay, so if just looking at these lungs, you can be able to tell according to the lobes that they usually have. I can only see two lobes here. So this is, we have the superior and the inferior lobe, and then we've got the oblique line that usually passes along these two leaves. Okay, so the lib A here, it's the lib that is just having what we call bronchial pneumonia. Then the second one, it's a lib, same lib on the same location, that's on the left, at the left side. We have the lobar pneumonia, which is just the gray hepatization. Okay, all right. Okay, then the other component is the bronchopneumonia. Using the X-ray, the radio, the radiation, you are going to, it's going to appear like this, where you find yourself at the left one, even the way it's appearing. When you check on these two pictures, you realize that on the right one we have the bronchial pneumonia, as well as the left one we have the lobar pneumonia. Okay, now these conditions, the pathology of the respiratory tract, it is one of the serious life-threatening one of the serious life-threatening condition. And the common organisms are just gram-negative bacteria. So gram-negative bacteria is the one that usually affects the lower part of the respiratory tract, of which we have Pseudomonas aeruginosa, as well as Acinetobacter baumannii and Enterobacteriaceae. Then we also have the gram positive bacteria where we have Staphylococcus aureus. Okay. Then atypical pneumonia. What is atypical pneumonia? Typical pneumonia is the pneumonia that that comes as a result of what? Mycoplasma or viral pneumonia. It comes as a result of a virus, the viral pneumonia. Then it is also very much common in children as well as young adults because it comes in form of a virus. Okay, then mostly common organism like that really causes this one, it's mycoplasma pneumonia. As well as when we talk about the viruses, we include influenza virus, of which we have type A and type B. Then the respiratory syncytial virus. Okay, this one also is one of the major causes of the atypical pneumonia. Then adenovirus, as well as rhinovirus and the the Varicella viruses. Okay. Then a typical cross-examination, you need to pass or it may involve the whole lobe. The affected area just colored red blue. Then they are congested. So microscopically, you're going to see the alveolar septa that are wider, and the edema are just mononuclear cells that are infiltrated, they just the alveolar septa that's just wider. Then we have edema, which just usually occur. You see some inflammation, swelling, mononuclear, where you find just to see just one nuclear within the cell. Then also cells that get infiltration, where you have a monocyte, plasma cells, as well as the astrocytes. So these are the cells that can be observed. Now remember, we have what we call aspiration pneumonia. No, aspiration is when like breathing, like we've got those aspirator, the one that really helps people to breathe, especially those people that usually have difficulties in breathing. Okay, this one is common in patients with some conditions such as unconscious patient or during repeated vomiting. Okay, so those people that are common just unconscious, those people that are just repeating vomiting. And it is also common in abnormal gang reflex, or rather swallowing reflex that predispose to aspiration. Okay, aspiration. So aspiration pneumonia. So when you look at the gross part of it, we have bronchial pneumonia as well as the lobar pneumonia. Microscopically, we usually look for the neutrophils, the one that are rich exudate. They are often necrosis in the alveoli. So these are just excluded out from the lung tissue. Then complication can also lead to what we call lung abscess, which is very common. Okay, then we have what we call necrotinizing pneumonia and the lung abscess. This one, the clinical source, we have the clinical features of manifestation. It comes with high fever, cough with full smelling, purulent sputum. Then there is also chest pain that is experienced. The other name for chest pain, it is angina pectoris, which is just the pain that is radiating or emanating from the chest. Then weight loss. Weight loss, this is where you find out that a person is losing weight. They've started just losing weight. So this one also is just measured this. Okay, so this is how we can see the X-ray of these lungs. Then this part on the left one, you've seen that that's where just the peritoneum where the heart occupies. Then you can see the reason why the right is like this, and the reason why the left lung is like the way it is appearing there. Okay, so these two lungs microscopically, remember anatomically a part of it, the right lung, it has three lobes. Then the left lung, it has just two lobes. Okay. Now, let's look at pulmonary tuberculosis. Pulmonary tuberculosis is caused by myotuberculosis, which is just the most infection that is acquired by person-to-person transmission. So in short, this one is just a airborne disease which is just transmitted by the droplets of the organism from an active case to a susceptible host. A susceptible host, it is just a person that is doesn't have this disease. So the moment you just come into contact with these airborne droplets, you are likely to get this disease. Then TB infection leads to the development of a delayed hypersensitivity to the myotuberculosis antigen, which can be detected by the tuberculin skin test, which is the TT. So the TT is the test that is used, which is used to detect what we call this bacteria, or rather the pathogen that causes pulmonary tuberculosis, which is called, the test is called the tuberculin skin test. Then they classified, so these pulmonary tuberculosis are classified as two types. We have the primary pulmonary tuberculosis, as well as the secondary pulmonary tuberculosis. Okay. So the primary tuberculosis, so primary tuberculosis, this is just an infection at the lung that is composed of the gone complex. Then the lung infection at the lower segment of the upper lobes. Remember, the upper lobe starts from the inferior part of the clavicle. So the inferior part of the clavicle, that's where the upper lobe, the apex of the lungs originates from, or the upper segment of the lower lobe, which is just the gone focus, then infection of just the hilar nodes. Okay, then let's look at the secondary pulmonary tuberculosis. This one, it is just the reaction or reinforcement of primary tuberculosis, which is just asymptomatic. So the secondary one does not show any signs and symptoms. The primary one, at least it usually shows some sign, but the secondary one, it doesn't show signs and symptoms. It's asymptomatic. Then the common infection are just at a high oxygen, that is just at the apex of the lungs. Then it is just severe to lung damage and produced cavity. It produces what? And produces cavity. So it can lead to damage of the lungs and other lung cavity. So this is what is happening. Have you seen? Lungs are getting damaged, and this is where now when you conduct a normal X-ray, when you look at the lines, look at the way they appear in front. That simply tells you to say there is an abnormal uh, destruction of the lungs. These are just cheese-like lesion, which with cavities of the at the apex. So at the apex, when you look at the top part of this lung, it has what we call the cavities and whatnot. So this is just abnormal. Then this is just the, okay, so this is how they appear histologically, and then this is just also a diagram that shows an increase in immunity. So this is what happened based on what I was saying the other time. Okay. Okay, this part we've already looked at this. We've already looked at this. We've looked at this. We've looked at this. Then we've looked. Okay, we are here. Okay, so if there are questions, let me start having those questions before we make progress. Okay.